About 13 billion lab tests are performed every year, but how many patients are actually prepared for this? The biggest communication barrier that we tend to have is the lack of communication between the doctors and the patients. Most people are not aware of what fasting is, or what fasting required labs are, or even if their insurance provider will cover the certain type of tests that are being requested of them. In 2013, there was a study of outpatients where 39% of the patients knew what fasting was, 52 of the patients were not informed of instructions or fasting or anything before coming in, and 60% of the patients actually came prepared. Most people aren't aware of it, but we do push this a lot for our patients. There are a lot of common tests like lipids, A1Cs, LDHs, and many more that do require fasting of the patient before getting drawn. It's important for our patients to know of it so that the results can become accurate as possible for the doctor, and also it can alter their medications and dosages that they do take. It's important for patients to know this because if so, the doctor can have them reschedule, or it can result in them having to come back and get redrawn when they actually are fasting. Another big communication barrier that we do run into is patients not knowing the coverage of their insurance. We have people coming in who come in weekly, every other month, or even just annually, and lab work can get quite expensive. There's times where there's lab work that ranges from $8 to over $300, so it's really important for a patient to know what kind of coverage they have beforehand. A lot of people are not aware that Medicaid and Medicare, a great example, have limitations on how many times a test can be performed. Common tests such as A1Cs and vitamin A's and B's can only be performed about 4 times a year. A lot of patients are not aware of that, so it's important for them to keep track of how many times they get it done and how many times their doctors are requesting them to get it done so that they don't run into any type of surprise billing. Another big thing is patients need to be very cautious about how much they come in for lab work and what kind of coverage they have. They need to find the best one that suits them by comparing and contrasting different policies and deals to make sure that they're getting the best coverage because it can get quite expensive. When it comes to informing our patients, we want to reach out to our biggest clients and our biggest doctors' offices that do use us for lab work mostly. It's important for us to inform them to inform their patients. A lot of people come in straight from the doctor's offices not knowing of these certain procedures that need to take place beforehand. So by giving them a resource such as a flyer or a pamphlet, just allowing them some information about what needs to be done before coming in, it'll allow them to feel more confident and not feel frustrated when things aren't going their way. So for the flyer, it just be very simple, just going over what fasting is, some things they can do to prepare themselves, such as what fasting is, why it's important, some different steps they can take in order to inform themselves by simply calling us or their doctor for more information. It also will go over different insurance coverages and how to find the best one for them. Over 77 million people have a basic or below basic understanding of health literacy. So by keeping our pamphlet very simple but informative, will allow our patients not to feel intimidated by this, but also use the information to the best of their advantage. So by just jumping in front of this health barrier and this communication barrier, this will allow our patients to come in more often for lab work and also not feel so frustrated by not being informed of these steps that we require for them to take.